Hi, so my name's Dane, I'm one of the vets, and this is Rob, and this little handsome fella is Smithy, and he's in for a geriatric check today, so we're going to give him a little bit of a looking over. We're going to have a chat about some of the things we find. He's 9 years old, he's a rescue dog, and looking at his history there, he has had a tie back, which is he's had part of his larynx opened up so that he can breathe a bit better, and that was done about a year ago, so we'll be having a look at that and just give him a good checking over really. I've spoken to his mummy and everything seems fine with him, apart from the fact that he has put on a bit of weight over the last year or two, so we'll be discussing diet, and what we'd recommend is probably a prescription diet and regular weight checks for that. So we can have a look at him and go from there. So this is handsome Smithy, and very good boy. He's still got his bits on, so he's not been neutered. So we'll have a look. So first things we're seeing here is he's got some tartar here, and he's got some slightly smelly breath. He's got some gum recession, and he's going to need to have his teeth scaled and polished, possibly to have one tooth taken out, possibly this tooth here. In fact, this tooth here is almost definitely going to need to come out because the gum's really recessed and it's probably a little bit loose. So he's going to have a little dental operation, and although he's 9, anaesthetics are usually very, very safe. But we'd at the age of 9, we'd recommend taking a blood sample beforehand to check his liver and kidneys and everything, and his blood levels to make sure everything's fine before any anaesthetic. So up you come, pop it. There we go. So carrying on, have a little feel of his lymph nodes, his glands. Also, older dogs often get a bit arthritic. One of the places they often get is in the elbows, and I know when mummy needs to slow down a little bit, so have a little feel of his elbows. Have a look at his nails. Okay, so this side as well. There you go, little man. I know nobody likes you touching the toes, do they? So a couple of things to look out for there. Nails often grow as they get a bit older. His aren't doing too bad. So look at the dew claw nails as well. Just to make sure they're okay, because they can often grow. So we're going to have a little feel of his tummy, make sure there's no lumps and bumps, and having a good feel there's no lumps and bumps anywhere. And have a look feel along his back. Dogs, like people, can get sore backs. Have a feel of his hips. Oh, there you go. And then at the same time having a feel of his knees, feel of his ankles, his hocks. So I'm checking there's no signs of any arthritis. As dogs get a bit older, they often get a bit arthritic. So actually, Rob, let's open up his. There we go. Let's pop that off, and I'll have a little feel, have a listen to his chest, because one of the things that with his operation before is he's going to be a little bit more prone to pneumonia. So I'm going to have a good listen to his chest and his heart. Okay, that's fine. You can hear he's a bit snory. I think that's more of he's probably got soft tissue. His soft palate's a bit long, which often happens in dogs with a shorter nose, but sometimes when they've got a lot of tissue around the head as well. So, and I think that's what the situation is with him, which is fine. But sometimes in brachycephalic breeds, like really short-nosed dogs, they sometimes need an operation to help that out. So that seems fine. I've had a little feel whether his operation is, so he's fine. He's a little bit overweight. I need to have a look at his ears as well, actually, because I know that his ears. All right, pop it. I'm just going to have a look at one of his ears over here. It's a little bit waxy, so have a quick look at that. Rob, if you can swap places, that's great. So we have a little look at his ears, because obviously ears are very, very important, because they can be a bit sore. So if you're nice, a little steady up there, have a quick look at his ears as well. There we go, my handsome boy. So the ear canal goes down, and then along, feels a bit weird, but that's all fine. Cool, let's swap places. Just have a quick look at the other ear actually while we're there. He's been such a good boy. He is being such a good boy. And then, that's a lovely little, just chin there, there we go, little fella. All right, little man. Hey. So, in recap, what we've got is this handsome boy is, he's obviously a little bit overweight, so we're going to recommend a bit of a weight control program because we like to get them back to normal weight of about 6 months. So we recommend a prescription diet and monthly weight checks with the lovely nurses. And he needs to have a little dental procedure, just to, I know, little man, just to tidy up those teeth, get rid of the tartar, and possibly take that tooth up there. We'd recommend a blood sample beforehand to check everything's fine. And obviously the other thing, obviously, because he's had this operation, we're just going to keep a close eye on any pneumonia, because there is a slightly increased risk of him getting pneumonia as he ages. And that's about it really. And it wasn't, I think we'll all agree, he was a very, very good boy. And then we'll also be talking about keeping up to date with his flea treatment, his lungworm treatment. Where we are in London, there is quite a lot of lungworm around, so we've got to make sure we're up to date with all that sort of stuff. So we'll be just checking that. And another one. One more treat, and then it's onto the diet. How about that? Okay. And that's about it. Thank you.